Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us once again. Going to have a conversation with Dr. Sue Liebman. She's an orthodontist and basically has been around orthodontics her entire life, and she's joining us on the program today to talk about her collaborative approach to orthodontics and overall oral health. Welcome to the program, Dr. Liebman. Thanks.
Thank you so much for having me. Thank you. It's a pleasure to be here.
Well, I said that I believe you've been around orthodontics your entire life. Give us a bit of your background and talk about how you got so involved in orthodontics.
Well, that actually is true. I have been around it all of my life. My dad started this practice about 50 years ago, so I literally have grown up in the field of orthodontics and coming into the office as a child, and his love of the field was contagious. So this has been my path and my dream, and I've been practicing. We were practicing together while he was still in practice for 25 years, and I've carried it through. So I'm now doing this 32 years from the professional side as opposed to the other side. So I literally have grown up in the field. But it's really been quite exciting to see all the changes that have taken place in the field of orthodontics now.
Well, here in the United States and around the world, folks are, I guess for lack of a better term, obsessed with achieving that perfect smile, that television, that movie smile. How do you feel about the perfect smile? Is there one?
Well, no, there's no one perfect smile. There's no one size fits all. And I think that is why the approach that I've taken and what's always been what I see my role being here is to, number one, tell every patient that walks through the door, go over with them what it is that is going on with their mouths, how to make their mouth is healthier, what it is that they're concerned about, what it is that brings them through the door. That's so important to hear from the patient and to know from the patient. And that's what I enjoy doing after all these years of doing this. That's what makes each case, each patient unique. And there's no one right fit for the type of braces. It's not your parents' braces anymore. And there have been so many developments and so many changes, and there's so many options out there for our patients. So it's really my role to hear what they have to say, and to then couple my experience and what's out there with what fits their lifestyle best. Obviously, I want to do what's best for them, and there should always be primarily the desire to get the healthiest mouth that you possibly can. But within that realm, it's important to take into account what their concerns are and what their restrictions are, what their ideas are, what their lifestyle. You can't factor life out of the mix here. You have to take life into account in the decision-making process, and that's what it should be. It should be really, truly a collaboration between patient and professional, and it's my job to tell them all the options, to discuss all of the possible ways to treat, and now with so many different treatment modalities that are available to us that weren't available in years past. Now with Invisalign, with clear aligners, inside braces, removable braces, different stages of treatment, different phases of treatment. There's so many possibilities out there that really what I love to do is just sit down with my patients, get to know what their thoughts are, and present to them all of the options. They can mix, they can match, we can pick and choose and sit down together and figure out what it is that makes the most sense for them and what they can manage with. And they have to feel comfortable with it. They have to know that what they're embarking on is something that they can feel good about. Sometimes you can even do a simulation as to how your teeth are destined to look at the end of treatment, which is always very helpful. There are just so many tools out there that we didn't have years ago.
Well, maybe the tools have not been available, but some of these things that you're discussing, lifestyle, their nutrition, all of these things, haven't they always been important when it came to overall oral health? Or are these things that we're just finding out as opposed to thinking, well, teeth are teeth, you keep them or you pull them?
No, absolutely. I mean, the goals have always been there, and the reasons for doing orthodontics and correcting how the teeth come together have always been there and have always underlined the treatment and the reasons for intervention to get the teeth in a more coordinated fashion. It's not only for aesthetic reasons. You want to get the teeth into a coordinated relationship where they function optimally, where their long-term health, you're maximizing their long-term health, which is housing the teeth in a framework and having them come together in a relationship that's not traumatic, that is best for digestion. It's best for the overall long-term health of your gums and the supporting tissues and the supporting structures that house the teeth, so that there's so many beyond purely aesthetic ones that warrant intervention. And nowadays, we know the prevailing wisdom is to actually intervene possible at an even earlier age than we first thought. I think that's been the misconception most widespread, and all of the organizations actually advise that the consultation is really between ages 7 to 9, when there's this beautiful mix of baby teeth and permanent teeth, and that's the best time to jump in and really take control of how the teeth are due to come in. But there's no age limit also, and I think a lot of our adult population realizes that, if they, for whatever reason, didn't intervene when they were younger, and now they have the means or they have the awareness. I mean, there's a much greater awareness because of the desire to get the perfect smile. There's a much greater awareness of the teeth in general and how it affects so much more than just your appearance, but how it affects your ability to function and chew your food and ensure that you have better long-term health of your mouth, because your mouth is part of your overall health, and it is the window to the rest of your body.
And I've noticed lots of people, well into their 50s who are electing to get braces. Is that part of this awareness?
Absolutely, and it grows exponentially. Other adults will see other adults with braces or with Invisalign, and they'll realize that it's not too late. Something can still be done. If they thought that their time has passed and they can't correct anymore, that's not the case. We have patients through their 70s that are, for one reason or another, embarking on orthodontic treatment. So there is not an age limit to it. So although it used to be seen as kind of a rite of passage of adolescence, it's now done earlier, but there's also this greater awareness in the adult population that, now they might have the means to correct or just the know-how that there are possibilities out there. And with the newer treatment modalities, they realize they don't have to necessarily be walking around with the traditional metal braces of old. There are a lot of different treatment options where they could, and that's where lifestyle fits in. That's where they can truly choose what they feel they can manage with. If they're talking to the public, if they're, engaged in those kinds of jobs where there's a lot of contact and they don't feel like they can be comfortable wearing the traditional braces, they can most often go with the route of the Invisalign or the clear aligners, and that's where the other newer treatment modalities have really made inroads in that part of the population, understanding that there are possibilities out there. You definitely can still correct.
Well, where can we go online in wrapping up and get some more information about your practice and some of these new modalities as well?
Well, definitely you can go to any of the organizations. I'm Brooklyn Heights Orthodontics. Happy to be a resource for anyone who wants information as to the various treatment modalities that are out there, what's possible, what can be accomplished, the reasons why things should be done. So my website is Brooklyn Heights Orthodontist or Brooklyn-orthodontist.com, and all of the American Association of Orthodontists definitely have directories, and many have YouTube. There are even YouTube videos that can actually give you a little bit, although you do have to be careful which ones you access there. But I would stick to the organizations or professional office websites that usually have a lot of informational material. But certainly, I'm definitely be happy to just share my experience and my information. I mean, this is why I've been doing this for as long as I have. There's a true love of what I do, and and I'm here as a resource.
Well, I thank you for coming in and speaking with us today, Dr. Liebman. It's been a pleasure.
Thank you so much for having me. I appreciate the time.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Sue Liebman. Transcripts and audio of this program are available at healthprofessionalradio.com.au. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.